In this video, we're going to talk about the scope of alcohol and drug policy and kind of different ways to target certain actions using policy, as well as who's actually involved in the policy making process, which is a very important issue, but often an understated issue. So what is alcohol and drug policy? Well, for any product to be used, whether or not it's a psychoactive substance, it moves through this progression. It goes from production to distribution to possession and product use. Now, alcohol and drug policy are the laws, programs, and regulations designed to influence substance use along this pathway. So, for some substances, we simply prohibit production, distribution, possession, and use. For others, we regulate production, distribution, possession, and product use. And prohibitions could be things like heroin or cocaine. Regulation are things such as tobacco, alcohol, and now marijuana in most states. In general, policy is an upstream method to preventing disease, and we'll talk about upstream and downstream in another video. But even within this upstream intervention that we call policy making, there are policies that can directly influence an action and indirectly influence an action. And sometimes for these indirect effects to occur, you have to kind of connect multiple dots before you get to the end. So we're going to talk about drunk driving. So in alcohol policy, there have been programs and messages to curb drunk driving for many decades now. And there's some policies which particularly impact drunk driving, directly impact drunk driving, and there's others which are much more indirect, which influence consumption, which then influences drunk driving. So let's go through some of these examples. So in a drunk driving policy, a direct policy is something that specifically aims to decrease this specific behavior. These include limits on blood alcohol concentration. So most states are at 0.08 is the legal limit for alcohol in the system. Utah just passed a law that's 0.05, although whether it's fully implemented is still up for debate. There are zero tolerance laws for people who are underage. So if you have any alcohol in the system and you're in your system and you're underage, that's seen as a violation. And then there are things like license suspension. So if you're caught driving drunk, your license is automatically suspended. And even warning labels. That's when a warning label includes drunk driving provisions, that's actually a direct policy aimed to decrease this one specific behavior. And in the chart below, this is looking at how enactment of 0.08 BAC laws affected alcohol-involved motor vehicle fatalities. 0, the dark line in the middle, just means that there was no effect. Any of the positive numbers means that there was a significant increase, and any of the negative numbers means that there was a significant decrease in these studies. And it's not universal, but the vast majority of the studies are demonstrating that there was a significant decrease in drunk driving after the implementation of 0.08 laws, pretty conclusively, actually. But those are direct policies. Again, there's indirect policies which decrease alcohol consumption or are intended to decrease alcohol consumption, which might decrease the prevalence of drunk driving down the path. And these are things like taxes, server liability laws, mass media campaigns, kind of PSAs, and minimum drinking age laws. So we do know there's good science showing that if we increase the minimum drinking age, then we decrease drunk driving prevalence. And then there are some very indirect policies, and I use very indirect policies because they're actually aimed to help situations beyond alcohol and drug policy. So they're not even directly impacting alcohol consumption, they're impacting the environment which might promote excessive alcohol consumption. And these can be things like anti-poverty campaigns or work programs where you're creating an environment that will decrease overall alcohol use but aren't necessarily intended to decrease overall alcohol use. So you have direct policies which specifically target a specific behavior. You have indirect policies which target the consumption that can lead to a specific behavior, and then you have very indirect policies which focus on the environment where consumption can occur, which then can lead to a specific behavior. All right, very important. So those are the types of policies out there, very broadly. They can be applied to any substance, but it's a very broad overview. But importantly is who is actually involved in making these policies. And we'll go through each one of these in turn to kind of discuss or at least describe who's involved. So first we have policymakers. These are our senators, our representatives, the regulators in the executive agency, and our judges. So senators and representatives make sense. We elect them to make laws. It's pretty straightforward. But oftentimes the laws don't actually specify one single thing to do. They simply tell an executive agency branch to come up with regulations to address a topic. And this means essentially career administrators are creating regulations, hopefully with using best practices and available scientific information, but it's a little more behind closed doors. They're not actually elected to do this. They're hired to do this. And then judges always have final say. If a law is challenged, a judge can uphold it, they can change it, or they can withdraw it and call it unconstitutional. Now, the industries that are being impacted also are involved in policymaking. These are producers, the distributors, the retailers, and what they do is they spend very large amounts of money, oftentimes, in lobbying activities. So they'll lobby certain legislators, certain representatives. They'll actually lobby the regulators themselves as well to curry more favorable policies or cut off and eliminate the possibility of policies which might be good for public health but harmful for their bottom line. There are industry-related organizations. So these are essentially trade associations that advocate on behalf of an industry. So alcohol is a good example. You have in the US, you have the Beer Institute, which advocates on behalf of most of the beer producers, at least the very large beer producers. You have the Wine Institute, which advocates on behalf of numerous different wineries and vineyards. And you have the Distilled Spirits Council, which advocate on organizations, on manufacturers that produce mainly distilled spirits. You also have things called Social Aspects Public Relation Organizations, or SAPROs. And these are organizations who aren't trade associations. They're not directly advocating for specific companies, but they're paid for, they're completely sponsored by these companies, and they're doing things to promote the industry in general. So again, in alcohol, it's kind of a good example. You now have it's the International Alliance for Responsible Drinking. It's funded entirely by the alcohol industry, and what they do is they consistently promote new policies and new programs which will primarily benefit the industry and oftentimes harming public health. And then finally we have nonprofit organizations, non-governmental organizations, and individuals themselves who are advocating on either their behalf or on someone else's behalf to reduce substance use and substance-related harm. These combined, all of these people play their role, and they're all very important roles. The one thing to keep in mind is that the individual or the nonprofit organization may have a very good message. It may be a very good public health message, but it's often drowned out by industry and industry-related organizations simply because they have more resources. They can spend millions of dollars in lobbying, where a nonprofit or an individual can't.